Thousands of medically qualified refugees could help ease NHS workforce pressures if specialist programmes to help rebuild careers were expanded nationwide. That's the message from charities and healthcare employers. There are an estimated 2,000 refugee doctors currently living in the UK, many more refugee nurses, midwives, psychiatrists and allied health professionals. And yet, despite being legally entitled to work, many struggle to return to the professions they've spent often years building in their previous homes. Maeve Hully is Director of Volunteering at Helpforce. That's a charity that's calling for more investment in practical routes to help refugees into work. Maeve, good morning.
Good morning.
Tell us about the specific barriers that prevent these health professionals working in the NHS.
So it's really important that all of the patient safety requirements are met for people coming to work in the NHS. So things like general medical registration, the NMC registration for nurses, people have to satisfy English language requirements, and they also need to meet all the necessary NHS clinical standards that would be required for any medical profession working in the NHS. And these take quite a long time. So you have a cohort of people who are medically trained but aren't able to work because of the time that it takes to get all of these bits of the jigsaw in place.
Do you have to, sorry to interrupt, do you have to sit an exam essentially to show that your experience meets the expectations of the NHS?
There's quite a lot of different routes in, the GMC will require a certain standard. There'll also be English. People will be required to demonstrate that they can speak English up to a certain level, and that's quite often takes the form of an exam as well.
Sure.
So it's quite rigorous, rightly so. What we're offering is really a practical solution that helps clinicians overcome some of the barriers so that they can return to the professions that they've spent years building. This is not, all of those other things must happen. But what we have discovered is by offering people an opportunity to volunteer and be if they volunteer, becomes a bridge into this paid employment. So, for example, while people are waiting, they can get to understand how our healthcare system works. They can have some opportunities, to meet people in the local NHS that they're going to be working in and things like that. So it's just another opportunity for people to get additional skills while they're waiting.
I can see how it makes total sense. And there are essentially untapped skills, resources here that the NHS could be using. So these kinds of volunteering schemes are in place in parts of the country, is that correct?
Yes, and we are urging greater investment in that, so we can roll that out to more areas, so we can make sure that we have as many volunteers working in this space.
Yeah,
and while they're waiting to get the registration organised.
The Department of Health has essentially said that there are these successful volunteering to employment programmes in the NHS, but they tend to be developed locally within individual trusts who are best placed, they say, to identify the workforce needs and build the relationships with voluntary sector organisations that make these pathways work. In other words, leave it up to your local trust, your local practices, and they will be able to sort of set up the systems and identify the needs for their area. Doesn't that make sense?
Well, I think it probably does make sense. I don't think there's enough of those smaller opportunities happening. And I think Helpforce have an opportunity because we work right across England. We have an opportunity to work with individual trusts to make sure that the volunteering that's available locally it is supportive and is helpful. I mean, we know from our experience that volunteering is good for the NHS, it's good for patients, and it's life-changing for the individuals involved. So this is about building on what we already have, and it's about working really closely with local trusts. We also try to evaluate all of the different programs, our volunteering programs, and by working across, we have an opportunity to evaluate right across the system.
Understood. Well, we're going to talk to somebody who's currently, a doctor from Ukraine actually, who's currently volunteering along in one of these programmes in the UK, and we'll find out how that's kind of benefiting her and where she might want to take it. But thank you very much, Maeve, for your time this morning. That's Maeve Hully.
Thank you for the opportunity.
Thank you, Maeve Hully, who's Director of Volunteering at Helpforce. It's 7:51.
The heat waves of the summer have led to wildfires across the UK and Europe, but the driest July on